Hello everybody, I'm Chiara from Spezzeria Palazzo Vecchio and since in a few months we will approach the winter season, today I would like to tell you about viral infection disorders from which everyone has suffered at least once in their life. First of all, let's define what flu is. Flu is an acute respiratory disease caused by flu viruses. 4 different types of flu viruses have been identified so far, all belonging to the Orthomyxoviridae family, and the types are A, B, C, and D. However, there are other viruses that cause symptoms such as those of the flu, such as rhinovirus and coronavirus, which we are unfortunately experiencing. The reason why flu is so widespread is that these viruses tend to mutate, which means that even if we contracted the same virus the previous year and we therefore developed immune defense that can fight it, when the virus mutates and our body comes into contact with it, these same defenses will no longer recognize it, and therefore the infection can develop very quietly and spread very quickly. That is why it is necessary to repeat the vaccine every year. Flu viruses are mainly transmitted by air and spread very easily through droplets of saliva that patients produce by coughing, sneezing, or simply talking, especially in crowded and closed places. Transmission also occurs by direct contact with infected people or through tools or objects, since flu virus can persist for a very long time and penetrate the body through the mucous membranes. Let's talk now about symptoms. The flu syndrome is characterized by sudden fever, generally above 38 degrees, usually dry cough, sore throat, headache, bone and muscle pain, and severe exhaustion. Sometimes other symptoms such as photophobia, which is the excessive sensitivity and intolerance to light, and also inappetence may be present. The most common complication is the addiction of a bacterial infection affecting the respiratory system and ear. Flu disorders all share the need to stimulate the immune system to respond adequately to the current infection. And in this regard, there is a plant I would like to tell you about because there are numerous clinical studies that demonstrate the activity of Echinacea on the immune system. These studies show that it stimulates macrophages, which are the blood cells responsible for phagocytosis, that is, to incorporate and destroy viruses and bacteria during infections. It also stimulates the production of T lymphocytes, which are the cells that participate in the inflammatory process. The use of Echinacea is therefore indicated in the prevention of any viral or bacterial disease in colds and respiratory diseases. The tolerability of Echinacea is very high, so much so that it can be administered to pediatric children over the age of 3. Another well-known immunostimulant is the good old vitamin C. In addition to protecting cells from free radicals, it increases the production of interferons and immunoglobulins, which are protagonists of the immune defense. This is why it is an excellent ally in the winter period to combat colds. Flu is caused by a virus, and the best antiviral present in nature is thyme. It is a very powerful antiviral and antibacterial, and is able to inhibit microbial proliferation at very low concentrations against various bacterial strains, including antibiotic-resistant ones. Now let's talk about another element in nature that is excellent in case of flu, the very famous and super used propolis, which is antiviral, anti-inflammatory, antibacterial, and healing. Flavonoids, aromatic compounds, essential oils, they are among the most responsible for its anti-infectious action. It is excellent for calming inflammatory states, especially sore throats. Last but not least, bud extract of blackcurrant is a valid alternative to cortisone because it acts by stimulating the adrenal cortex to secrete natural cortisol, which is the hormone that inhibits inflammatory processes without producing the harmful effects of pharmacological cortisone. Now I would like to focus on a particular molecule called quercetin. Currently, this molecule, already known for its antiviral and antioxidant effects, is being studied as it seems to function as a specific inhibitor for SARS-CoV-2. In particular, quercetin inhibits 3CL-Pro, one of the main proteins of the virus, essential for its development and whose blocking of enzymatic activity is lethal for SARS-CoV-2. The study was published in the International Journal of Biological Macromolecules. Well, quercetin and vitamin C, along with other antiviral active ingredients, are in our brand new ViruBlock supplement, or ViruBlock supplement, while Echinacea, propolis, thyme, and blackcurrant are in the InfluBlock supplement. Both can be taken as a preventive in periods close to the winter season in order to reduce the risk of contracting flu, but also they can also be used as symptomatic if flu is already in progress. I advise you, in any case, to download the product data sheet to take it to your doctor in order to evaluate contemporary taking or substitution to antibiotic drugs. Well, that's all for today. Thanks for being with us. A greeting from Spezzeria Palazzo Vecchio.